Welcome everyone, and thank you for attending this webinar with FullScript and Dr. Silverman. My name is Sarah. I am part of the marketing team here at FullScript, and we are very excited to have Dr. Silverman with us today to discuss protocols for longevity, optimizing health span, and human performance. Before we get into the presentation, I wanted to go through a little housekeeping first. So just a reminder that this recording will be sent to everyone who registered. So if you have to leave early or just want to watch it again, you will have access directly from your inbox. The recording will also live on FullScript's website, where you can access all of our past and upcoming webinars as well. Throughout the webinar, if you do have any questions, please add them to the question section and we will get to them during the Q&A portion at the end. And with that being said, I'm going to pass it over to Dr. Silverman to take it away, and I will rejoin you closer to the end of the presentation.
Thank you so much. It's my pleasure to be here. I'm truly excited towards the end of the year to really talk about longevity. Without question, longevity has been the hot topic, the incisive conversation of 2023, and I believe and beyond. My goal, 45, 50 minutes. I'm going to save some time for questions at the end. Hopefully we can get through any questions, any conversation pieces you'd like me to attend to. I'm going to share some ideas on the protocols for longevity, because our goal is to optimize health span and human performance. A quote that I said, it's kind of like a mishmash of a couple of people. The key to longevity is turning on the health switches. I believe the master switch is having a robust and resilient immune system. So I believe their cracking of the longevity code is protocols for longevity with the intersection of immunity, health span, and vitality. When we talk about turning on switches, we're not just talking about turning on health switches. We're also talking about turning off some switches. The right modulation is going to lead us to a homeostatic condition in the body that's going to lead to optimization of longevity. The backbone of that, I believe, or the key system, is without question the immune system. So we talked a lot about over the last year about health span versus lifespan. What's the difference? Well, lifespan is the amount of years that you live. Unfortunately, in the last few years, lifespan has retracted, it's decreased. Health span has dramatically dropped over the last couple of decades. So here we have lifespan, we'll talk about it as an 80-year-old person, and health span maybe being up to 65. My goal is to increase the lifespan, but equally and by functionally, if you will, get that health span to equal the lifespan. So I think a critical element is going to be lifestyle changes, and a critical concept in addition to lifespan and health span is health span, but truly vitality. I mean, my mom is 94 and a half. She's got a great lifespan. She was healthy to about 88, 89. And now that health span is gone. But that vitality lost, or the vitality she lost, was many years prior. You know, she could watch TV. She didn't have a chronic disease, but she didn't really do anything. She didn't want to go for a walk. She didn't want to go out to eat. She didn't want to do some of the things that she did. So I'm a big believer in lifespan, health span, and vitality. So for me, I put together these hallmarks of aging. The hallmarks of aging are interesting in that as I said before, want to start with immune system. I want to start with Immune Reboot. It's a book that I wrote in 2022 about rebooting your immune system. The key to rebooting your immune system is having good immune health, or working towards good immune health. And the backbone of that, or the secret sauce, if you will, is immune resilient. So throughout this presentation, I'll use that term immune resilient. What do I mean by immune resilience? Immune resilience is the ability of the immune system to be flexible, the ability to be mobile, to be resilient to a virus, a bacteria, a parasite, to be resilient to different variants, if you will. So if we have good immune resilience, we have good immune health, we've now rebooted our immune system. Inflammation, another hallmark of aging. I'm a big believer, and you'll see a slide coming up about the ability to manage and modulate inflammation. I think one of the biggest problems, if I could use COVID as an example, with that cytokine storm, was that most people were pre-inflamed. With my chiropractic background, I still see patients, musculoskeletal patients, and some of the problems really are based on the fact that, yes, they have a lower back injury. Yes, they have a rotator cuff injury. Yes, they have a headache, but they were pre-inflamed, which dramatically increased their symptomology and their unfortunate ability to contract this type of injury, the microbiome. I'm a big believer that 80% of your immune cells are in your gut. Your microbiome is a critical area. All your ecosystems of your microbiome, I believe, start and end with the gut. That's your number one microbiome. Number two would be your gums. That is a new conversation for 2024. 90% of people who have gingivitis make an enzyme called gingerpans, and 90% of those people have Alzheimer's. So this microbiome, that gum, is the second one, but it's really, really critical to overall health. And the microbiome, the third one that I would talk about would be the skin. Mitochondrial dysfunction. What's the number one reason why people go to the doctor? Number one complaint, they're fatigued. Mitochondrial dysfunction is tremendous fatigue. All these pain medications, these over-the-counter non-steroid anti-inflammatories, Aleve, Advil, ibuprofen, Tylenol, which is pain and fever, all damage certain complexes in the mitochondria. I believe that a large portion of our population suffers from mitochondrial dysfunction. Long COVID, a mitochondrial issue. Lyme disease, a mitochondrial issue. Mitochondria should function well. It should produce ATP efficiently. Fascial injuries, and I think this is overlooked by a lot of the other practitioners. Fascial injuries, the saran wrap of the body. It holds our body together in the concept of tensegrity. Fascia, which you'll see a slide coming up, you pull away the skin and you'll see the skin of a chicken breast. You'll see a white film, and at the bottom, you'll see the muscle. What's holding the muscle and the skin is fascia. Vagus nerve tone, cranial nerve number 10, a unique nerve. I've had 3 people come in today with tachycardia, POTS, and straight up parasympathetic dysfunction, all needing their vagus nerve to be reset. Telomere shortening, the telomeres, they're the caps at the end of your DNA. They're your shoelace caps, if we could refer to them in a metaphor, if you will. When they break or when they shorten and your shoelaces intertwine, that's when that DNA can not replicate in that particular organism, terminates. Loss of muscle mass. Muscle mass is the currency of longevity. So if you do anything, please do some weight resistance, body weight resistance, push-ups, air squat, front planks. Don't necessarily get on the cardiovascular machine first. It has its place, but the loss of muscle mass is a sign of sarcopenia, which is a sign of loss of longevity. Disrupted nutrient sensing, insulin signaling, mTOR pathway, AMPK, sirtuins, we will go into detail in the presentation, and compromised autophagy, your inability to break down old cells to make new cells, will allow senescent and zombie cells, cells that are dead, to still stay present in your body, contributing to your inflammatory status. Peter Attia, who I have a high regard for, once said, one of the most important things to understand when you're using some sort of intervention is, do you have a biomarker to know if you're doing it correctly? So I'm a big believer in assess, treat, and reassess. So we need biomarkers to assess longevity. Here are some interesting biomarkers to look for and to assess the status of your longevity. Number 1, interleukin-1 beta, interleukin-6, interleukin-8, and TNF alpha. These are all inflammatory markers. These interleukins are critical to determine if cytokines were released and where your inflammatory status is. The one I would circle out of these 4 would be, without question, interleukin-6. Interleukin-6 is one of the most dynamic markers of inflammation. It was shown to be so in musculoskeletal injuries, COVID-19, and many inflammatory issues. This should be a standard on all your blood tests, whether you're being a patient who's listening or whether you're being a practitioner who's ordering the tests. C-reactive protein, tissue inflammatory marker, or HS, C-reactive protein, high specific C-reactive protein for artery inflammation. Hemoglobin A1C. It's your average blood sugar over 90 to 120 days. with an emphasis on the 50% of the mark on the last 30. It is your blood sugar marker test, it is your diabetes and your pre-diabetes test. Everybody should be tested for hemoglobin A1C. For me, I believe that 5.4 or less shows positive effects for brain health. Even though you go up to 5.7, you're really going to be somewhere between 5.2 to 5.0, if that's possible, with the amount of sugar that America is exposed to. APOE4, there's a whole webinar on APOE4. Essentially, everybody here should know if their status is APOE4. There's three types of APO. There's APOE2, 1% of the population has that. In that 1% of the population will probably never get Alzheimer's. There's APOE3. Remember, there's two. I mean, you can get a 3, you can get a 3, 2. APOE3 dominant people are like me, we're neutral. If we have a bad lifestyle, we have a high risk of getting Alzheimer's. If we have a good lifestyle, we have a low risk of getting Alzheimer's. If you have an APOE4, or especially if you have an APOE44, you have an 80% increased chance of getting Alzheimer's. Everybody should know their genetic marker because you only have to take it once. And what would you do with an APOE4 marker? You would definitely go on what we would call a anti-Alzheimer's lifestyle program. An LPS, lipopolysaccharide. Lipopolysaccharide is a test that you would take on the intestinal wall. It holds gram-negative bacteria. It's an endotoxin. We can go into more detail in the ongoing slides. Some more biomarkers, LP(a), that's a cholesterol marker. If you have a overscore of 30 on LP(a), you have a 25 times increased incidence of a heart disease. Everybody taking cholesterol marker or cholesterol panel should test for LP(a). Blood pressure, great marker. Peter T has talked about that a lot. And you're looking at the blood pressure difference between the diastolic pressures. You're basically looking, everybody wants to be 120/80. You want to make sure the difference between the two markers are not 60 if you were to subtract, the bottom marker from the top marker. Body composition. It's not just muscle mass. It's muscle mass to body fat. So someone could have good muscle mass but have 30% body fat. They're still too corpulent. Their body fat is still too high. Telomere length we talked about before. VO2 max tests the maximum volume of oxygen during exercise. Max grip strength. Man, when I shake a 75-year-old's hand, male or female, and they still have a grip, I know that they have good muscle mass. Mitochondrial dysfunction, you can obviously test for that by testing for MDA, ROS, SOD, and GPX. And lastly, once again, zonulin. And that will be in a test that I recommend for the gut. Zonulin is a protein enzyme that was found by Dr. Alessio Fasano. It has been stated, you're only as young as your immune system. So you may have lived 80 years, but if you have an immune system of a 50-year-old, you are 50 years old. Immunity is the key to longevity. Tufts University and Boston U School of Medicine really answered the question. They found out that people who have a highly functioning immune system typically will allow them to live longer in a more academic and a more athletic life. Immune resilience, it's truly the key to resisting disease and living longer. So this is not solely age dependent. It actually, by having a good immune resilient immune system, can affect lifespan, health span outcomes. They tested centenarians, people who lived to 100 or more, and they found out that the centenarians had a strong microbiome. They had bacteria that lodged in the microbiome or lived there that was equivalent to people who were much, much younger. So again, one of the first things that you should all start with is having a strong, healthy, robust gut and gut lining. Time Magazine, 2004, had the cover. It was called The Secret Killer. It was inflammation. It's almost 20 years past that. As I said, my goal is to manage and modulate inflammation. But this inflammation is lying in most people for such a long period of time. Inflammaging is now a term that comes to mind. You're inflamed and it's causing a deleterious effect to your inside organ systems and leading you down a path of increased aging. So you may be 40 on the outside, on your date of birth, on your driver's license, but you may be 60 to 70 because of inflammation, or if you will, inflammaging. So again, a little talk about the gut. Here we have a healthy gut microbiome, which is diversity and richness. That's a key, biodiversity. I can't recommend people enough not to just take a pre and a probiotic, and I did say pre and probiotic, but to switch them. Sometimes I double down on 2 different kinds of formulas and probiotics because I want to avoid dysbiosis. Dysbiosis is a decrease in the variety of bacterial species and may have too much destructive species in your gut. Interesting, it's an unleveling dysbiosis of good and bad bacteria. You need about 85.1% of good bacteria versus bad bacteria. So you never have to worry about taking too many pre and probiotics. You never have to worry about being too healthy. And you do realize that a cheat day, not just one thing at a meal every so often, is extremely ruinous to one's overall gut health. So my strong suggestion is good diet, pre and probiotics. Let's take an overview of function of mitochondrial function, health, and disease. If the mitochondria is functioning well, ATP is being produced, a decrease in reactive oxygen species, allowing for growth, adaptation, and appropriate thermogenesis. As the mitochondria starts to become dysfunctional, we get a CA2 transport, which is metabolic stimulation, a stress response, too much reactive oxygen species, which is aging. Ultimately, dysfunctional mitochondria is inflammation or producing inflammation and also leading to apoptosis and cell death. Here are the diseases that are affected by the mitochondria: skeletal muscle and movement disorders. Again, chiropractic background. I see a lot of musculoskeletal patients in my functional medicine armamentarium. Metabolic disorders and diabetes, neurological disorders and autism. I want to stop right there. The number one mitochondrial organ in your body is your brain, and you're looking at a lot of autoimmune conditions and neurodevelopmental and neurodegenerative diseases with mitochondrial issues. Here's a picture that I believe makes the effect and what fascia is more evocative. It's that saran wrap of the body. You're seeing it because it's holding the body together. Again, please envision as I pull my hands apart, here's the skin, here's the chicken breast, that white film that's in between, that's fascia. Everybody's had a piece or a fillet of salmon or seen it, the white film on top. When you take a fork and you try and break into the salmon, that white film, that's fascia, the saran wrap of the body. Or everybody should realize that fascia is part of your extracellular matrix, everything outside your bone. It attaches to your skin. The fascial system is the largest system in the body and is the only system that touches every other system. Fascia is living matrix. It's your full body wetsuit. It's connective tissue. It's actually the sheath in the body. As said before, it's below the skin and above the muscle. Lymph nodes, nerves live in the fascia. It's a sensory organ, and it accounts for about 20% of your body mass. Fascia communicates 100,000 times faster than nerves. My favorite topic, vagus nerve. Vagus nerve, cranial nerve number 10, goes from the medulla oblongata down from the bottom of the brainstem all the way down through the transverse colon. It's bidirectional. It is 80 to 90% afferent. It's 10 to 20% efferent. The vagus nerve is a key neurological communicator between the gut and the brain and the gut. I believe it's the key component to the superhighway to health, which is your gut to brain axis, that bidirectional axis. So what's most interesting about the vagus nerve is when you look from here to here, you see all the organs that are innervated. Like I said, people who have tachycardia, it's because they could be contributing from a vagus nerve tone or decrease in vagus nerve tone. Breathing, digestion, vagus nerve, the rest and digest nerve, the wine and dine nerve. It's the parasympathetic nervous system. Most of our patients in America are too sympathetic. Therefore, the parasympathetics drop down. By increasing your vagus nerve tone, you are now balancing the autonomic nervous system. Vagus nerve tone is critical for overall immunity and inflammation. Both the afferent and efferent portions of the vagus nerve are anti-inflammatory. And believe it or not, The spleen, the vagus nerve communicates with the spleen via the vagosplenial nerve. The spleen is a respite for immune cells. These immune cells are in macrophages. These macrophages are released and they stimulate NF-kappa B. However, when you stimulate the vagus nerve tone to its appropriate level, the spleen releases acetylcholine, which blocks NF-kappa B and only allows macrophages to come out. So at the end of the day, proper vagus nerve tone and communication is 3 pathways of anti-inflammation, both afferent, efferent, and through the spleen. As stated before, stimulating the vagus nerve increases acetylcholine, reduces inflammation, improves outcome in rheumatoid arthritis and autoimmunity, and inhibits cytokine production by 30%. Let's avoid sarcopenia. Sarcopenia, we all lose 1 to 2% of muscle each year after age 40, and we may lose 25% of muscle mass by age 65. Muscle mass is a great endocrine organ because it can, when it's stout, efficiently dispose of glucose. So believe it or not, it's not just people who are heavy, it's people who don't have muscle mass that have a propensity towards diabetes. And of course, strong microbiome modulation is going to aid in muscle recovery and muscle growth. So again, Dr. Gabrielle Lyons has stated, muscle mass is the organ of longevity. So we talked about the switches. So what switches of aging do I want to turn on? Well, I want to turn on AMPK because I want to activate protein kinases, regulating the amount of energy, a nutrient and energy sensor, maintaining energy homeostasis, to stimulate AMPK, alpha-lipoic acid, berberine, omega-3 fatty acids, resveratrol, like these guys doing jumping jacks, high intense exercise, intermittent fasting, and of course, caffeine. Sirtuins protect the cell from damage. You want to turn those on. They repair and they reduce inflammation in the cells. They boost memory. They're also great to help impaired mitochondrial health. They're stimulated by NAD+, green tea, turmeric, resveratrol, quercetin, extra virgin olive oil, again, exercise, coffee, and intermittent fasting. So nutritional supplementation and good diet is a critical element to be able to enhance on the concepts and the aspects of longevity. Now, mTOR, a lot of bodybuilders like to jack up mTOR. I like to balance it and even dim it because this is a signal for growth rather than a signal for survival. To balance and dim mTOR, you can use resveratrol, quercetin, zinc, melatonin, omega-3 fatty acids, curcumin, vitamin D, the ketogenic diet, and intermittent fasting. So the takeaway is more sirtuins, less mTOR pathway, and more AMPK pathways. Turning on the right health switch is critical. Dimming and turning off health switches is also critical. Anti-inflammatory pathways versus pro-inflammatory pathways. Intermittent fasting. Paracelsus once said that fasting is the greatest remedy, the physician within. There is no formula for intermittent fasting. You have to do it on your own. It is an excellent free lifestyle hack. So what's most interesting about intermittent fasting is everybody talks about the numbers. How long do you fast? How long do you eat? So what I found to be most effective, and there's some new data to back this up, a 14-hour fast to a 10-hour feast or a window of eating has really shown to be most effective. And one of the reasons is it's effective for health promotion, circadian rhythm, and patient compliance. I don't like the OMADs. I don't like only one meal a day in that 4-hour period. I don't find that it works. Intermittent fasting is also shown to not touch acute inflammation, but actually quell and almost literally vanquish chronic inflammation. So autophagy, the breaking down of old cells, using the debris to make new cells. So autophagy does this plethora of different ideas, but the big idea is that breaking down of the cell and building up of a new cell. So autophagy from intermittent fasting is great for immune rejuvenation. It's great for mitophagy, the breaking down of old mitochondria and making new mitochondria. So it's your body's ability to cleanse itself and clean out old cells and make new cells, because old cells are senescent cells that are dead. They're walking around or floating around. We call them zombie cells, like the Boris Karloff zombie. Those zombie cells are spewing out inflammatory issues, so they create chronic inflammation. They omit protein destroying enzymes, and they shorten healthy lifespan. So autophagy and senolytics are great ways of removing senescent cells, which typically confer with healthy longevity. So let's take a look to the future. It's really not a look to the future. It's really what is here, in my opinion, now. The number one modality for longevity is a low-level laser, a non-thermal low-level laser that allows for the electromagnetic transfer of energy. It is shown to turn on interleukin 10, which is great in that its converse when you turn on interleukin 10 is anti-inflammatory, but it also turns out all of the pro-inflammatory interleukins. So it's able to manage and modulate inflammation, and the appropriate wavelengths in laser also stimulate the complexes in the mitochondria, 1, 2, 3, and 4, and turn that mitochondria back on to function efficiently. I'm a big proponent of functional medicine. I adhere. One of my mentors is Dr. Jeff Bland. He wrote the foreword in my book. He coined the phrase functional medicine, the idea of looking for the root cause resolution. So a great example is this slide. Looking at the tree, you're seeing diabetes, cancer, heart disease. You're seeing symptoms and diseases, but you're not seeing why, because the why to get to the root cause resolution is in the soil. It's from the body, looking at the body from the inside out. So one of the things that I think that we do not utilize enough in supplementation is the utilization of pro-resolving mediators. Pro-resolving mediators should come from omega-3 fatty acids. Now, everybody should be taking omega-3 and continue to take omega-3. I just believe that people should add the pro-resolving mediators to the omega-3s. So let's take an example of alpha-linoleic acid, flax seeds. Flax seeds are an inefficient multi-step conversion to EPA and DHA. It's only about 3 to 4%. Now, we all know that EPA and DHA are critical. Flaxseed and EPA, DHA are both omega-3s, but they don't convert. Omega-3s should convert to something called pro-resolving mediators, which allow for the resolution of inflammation. Similar to flaxseed to EPA, DHA, EPA to pro-resolving mediators only happens in a very small singular percentage. Therefore, we're missing out on that resolution of inflammation. Makes a lot of sense. America's too inflamed. So here are the pathways, and not to bog you down with biochemistry. When EPA and DHA are able to produce the resolvins, as seen here, the protectins and the maricins, you're able to go from the initiation to a lipid class switch to the resolution of inflammation. Now, what's interesting, in the resolvins help resolve inflammation. The protectins help protect the nerves versus inflammations, and the maricins help protect the muscles from inflammation. You need not only the pro-resolving mediators in a formula, you also need pro-resolving mediators with omega-3 fatty acids. So it's a lipid class switch. Nothing exemplifies more turning on the health switch than allowing yourself to convert or supplementally convert to pro-resolving mediators. Again, here you have the initial phase in the arachidonic acid. You're a class switch to the biosynthesis of lipid mediators with pro-resolving properties. You get to the resolution phase. When you're able to get to the resolution phase of inflammation, you're going to have tissue regeneration. So conditions that I would recommend everybody prescribe for pro-resolving mediators: chronic inflammation, chronic pain, chronic inflammatory disorders, IBS, IBD, long COVID, rheumatoid arthritis, psoriasis, chronic fatigue, gut issues, musculoskeletal issues, and arthritis. Neurological disorders, Alzheimer's at the top of the list, Parkinson's as well, type 2 diabetes, and any concussion. The key takeaways: pro-resolving mediators allow for the resolution of inflammation. They allow for the homeostasis between the initiation and the resolution of inflammation. Metaphorically speaking, it's turning on the fire on one of your oven stoves, cooking the food and turning it off. That would be a perfect scenario with pro-resolving mediators. Unfortunately, many scenarios, we turn on that fire on the pilot light too high, and we burn the localized tissue, the food right there. Sometimes when we pull away the food, it stays on the pilot light, and lights all the other pilot lights. That's systemic inflammation. So it does not stop acute inflammation, but it works in conjunction with omega-3s, not in place of. It's versatile, and I believe it should be utilized as a foundation nutritional supplement. So here are my longevity nutrients, and there's some formulas that everybody could use that are quite popular that incorporate a lot of these nutrients: coenzyme Q10, omega-3 fatty acids, pre and probiotics, B vitamins, resveratrol, magnesium L-threonate, methylated vitamins, vitamins D3 with K, maybe the new kid on the block, ashwagandha, 600 milligrams, and a good quality greens drink. So my lifestyle hacks or my longevity hacks, let's remember food. Let food be medicine. Let medicine be your food. Dramatically reduce sugar. The average American consumes 160 pounds of sugar per year. Way too much. Works with the reward center of the brain, which when mice were offered sugar, 94% of mice took sugar over cocaine. Ultra processed food, we've got to decrease. We've got to stop this. 63% of the calories that adults consume are from processed food. 67% of children calories come from ultra processed food. As Jack LaLanne once said, if man makes it, I won't eat it. It's just simple. Whole foods. Exercise, please incorporate resistance training. Remember, muscle mass is a longevity organ. Great hack, rejuvenative hack, sleep. Health detectables, I'm wearing one in the Oura Ring. I have no stock in Oura Rings. Meditate, your daily calm. Intermittent fasting, I believe most people, and maybe it's a webinar for future, women have to intermittent fast differently. The men just don't have the time to get into that now. However, intermittent fasting is a great tool for those that it's correct for. Low-level laser, the modality of the 21st century. Purpose, mission, and community. One of the things I like about FullScript is that they have a community. They support us in all our aligned services. Hormesis, hot and cold exposure. Your body's supposed to be stressed. Doesn't have to be too hot. That's on 140 to 160 degrees. 20 minutes, get a good sweat, get a lather up, then go in the shower or get yourself between 50 to 59 degrees. You don't have to go in cryotherapy. It's a good thing. There's nothing wrong with it. But what you want to do is you want to stimulate heat shock and cold shock proteins. Our bodies are made to respond to stimuli, and that stimuli doesn't always necessarily have to be so comfortable. Supplements, we've listed some, we're going to list more. And I believe a critical element for longevity is an intact gut barrier, and you want to remove food sensitivities. And real simply, I believe that the gut is the epicenter of your health. 80% of your immune cells are in your gut. You want to remove food sensitivities because food sensitivities, I believe, are one of the hinted reasons for chronic inflammation. Food allergy, you know it right away. We've all been on a plane and somebody said, or the flight attendant has stated, please, no peanuts. Somebody has a really bad allergy. It's immediate. It's an IgE response. Whereas food sensitivities is an IgG mediated response. And from the time to ingestion of the food sensitivity to the time that symptomology comes out, there's a 72-hour, 3-day lag. So how, as a practitioner, would I know that someone's sensitive to food? How would you, as a patient, know unless you test for it? So my theory is test and don't guess. So here's my concept. I'm a big believer, my rocket ship concept, N of 1. Everything that I do and I recommend, we're at that midway point of the webinar, is it's all about you. In that I want to individualize and personalize my treatment protocols for you in the N of 1. And the best way to do it is to look at your gut health. We could spend another hour on my gut matrix. Bottom line is, when we talk about the gut, we talk about the small and the large intestine. Typically, when we test for the small intestine. Small intestine has a whole plethora of things that can go wrong, like leaky gut, number 1. Number 2, small intestinal bacterial overgrowth, or SIBO. And number 3, I've coined it, it's called CFO, small intestinal fungal overgrowth. I'll show you a test that can test for several of those things and some other things like LPS. Now let's take a good look at the gut. I'm not going to go crazy intrinsically. Food sensitivities can cause adverse effects going on in the gut and or leaky gut. Yeast and fungal overgrowth is a problem, and dysbiosis. Incidentally, Candida, which we'll talk about in a moment, can lead to dysbiosis and leveling of good and bad bacteria. But if you have a leaky gut, you're going to have liver dysfunction because toxic and chemical overload are going to float in the blood. 75% of your toxins float in the bloodstream from your gut to your liver, and 25% go from your gut to your portal vein. So there's a gut to liver axis. If you have leaky gut, you have a higher incidence of blood sugar problems, insulin resistance, prediabetes, diabetes, obesity, autoimmunity is increased. Hence the idea of thyroid. 75% of my thyroid patients is not the thyroid the problem. The thyroid is the end result. Therefore, you've got to look at other things around it, like the gut and autoimmunity. The expression of LPS increases the incidence of heart attack by 3 times. I'll show you a slide to back that up. My musculoskeletal brethren, listen up. Arthritis and joint pain are increased because of excessive release of cytokines from leaky gut. There's a gut to joint, there's a gut to disc axis. MMPSs, matrix metalloproteinases, are released at the time of injury. They're released at the time of injury. They eat fibrocartilage. There's your gut to disc axis. 52% of 52% of disc surgeries had a bacteria translocation. Well, look how close our gut is to our lower back. And last, certainly not least, is the gut to brain axis. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Got bidirectionality. Whatever you do to your gut, you do to your brain in a millisecond. So food sensitivities, take a good look in how lifestyle can contribute to inflammation in many of our patients. Antigens and toxins trigger inflammation in the GI tract. They pass through this leaky to permeable gut, and that transmigration of antigens induces an immune response. Leaky gut leads to localized inflammation. An immune response can lead to systemic inflammation, ultimately to autoimmunity. So let's talk a little bit about IgG and C3D food sensitivities. In a nutshell, in an epigrammatic fashion, we always want to test for IgG when it comes to food sensitivities. But here's the key to it. Here's really the bedrock of the idea. The bedrock is it tests for IgG 1 through 4. This IgG3 enables you to test for C3D. IgG, these are antibodies. They come from your adaptive immune system, and now you're checking your adaptive immune system. So obviously, if you produce an antibody, something can be inflammatory. C3D is a complement cascade coming from your innate immune system. So let's take a second. Antibodies have the ability, I did not know this till I learned about this test, to stimulate inflammation in the most complement stable inflammatory molecule called C3D. So now in the test that I'm going to recommend is a dual pathway technology that's really leading edge. So for food sensitivities, where you would have the elevation of both the innate and the adaptive immune system, there's a color coordination. I would remove red, which would be a +4, red, immediate stop. Then I would have an orange, which is close to red, that's a +3, and then a yellow +2. So I would remove food sensitivities. Interesting, the food sensitivity removal is not critical over long durations of time, because when you remove a food, you don't only remove the food for a period of time, like a 3-month period. So the takeaway here is food sensitivities don't always have to be removed for perpetuity. They mean you either have a digestion problem, a leaky gut, or immune problem, or any one of those, or all of those 3 things. You address them, you can put the foods back in the reintroduction phase. And you can always test for food additives as well. And here's your gut barrier panel. So you're testing for IgG 1 through 4 and C3D. You're also testing for IgA. Now, IgA is an interesting antibody in that it talks to the idea of early onset. IgG, it's going to take about 21 days for these to come out, so it's going to be a longer period of time. So when you look at Candida, which is a yeast or yeast overgrowth, 97% of CFO, small intestinal fungal overgrowth, is Candida. You can see that Candida is causing damage with IgA at the mucosal lining. It's also stimulating the dual pathway in the innate immune system and the adaptive immune system, causing IgG 1 through 4 and C3D. I'll have a protocol coming up for that. Zonulin, a protein enzyme that has been found by Alessio Fasano that shows elevation of this enzyme, shows a pulling on the tight junction. Best way to show this, epithelial cell, tight junction. I'm trying to pull it apart and I can't. When zonulin is increased, it pulls apart these fibers, and that tight junction, I kind of could see you through there, now becomes a looser junction. If occludin is elevated, it shows that these fibers were broken. So zonulin is a functional pull on the tight junctions. Occludin is a structural damage. LPS, lipopolysaccharide, holds gram-negative bacteria on the inside of the intestinal wall. LPS here is positive for IgG 1 through 4 and C3d. It's been long-lasting. That person's inflamed. Zonulin, those tight junctions are starting to go. There's a strain there. Now, for me, one of the reasons that I circled zonulin was very simply, I believe that zonulin is a full-body marker, one that we should all look at. Now, what can raise zonulin? Well, the protein in wheat, don't eat any gluten in wheat, and any kind of adverse bacteria are triggers for zonulin release. It's a key biomarker for intestinal permeability. Elevated levels of zonulin are associated with autoimmune disease, celiac disease, inflammatory bowel disease, non-celiac gluten sensitivity, obesity, rheumatoid arthritis, multiple sclerosis, type 1 diabetes. LPS, as I said before, holds on the outer surface of the cell membrane, holding gram-negative bacteria. Gram-negative bacteria, 80% of it is pathogenic. So when LPS is positive, you're not only saying that this endotoxin, this poison almost, I nicknamed it El Diablo, is floating around in your bloodstream. Also, gram-negative bacteria is floating around in your bloodstream. You're going to have a certain duration of time that you need to fix your gut lining. It creates a direct epithelial damage in the gut, and LPS can also cross the blood-brain barrier. So LPS attaches to something called toll-like receptor 4. Toll-like receptor 4 goes through a specific pathway, MyD88, and stimulates NF-kappa B. In addition to that, it also damages the mitochondria and stimulates NLRP3. This dual signal pathway allows for cytokines and interleukins to come out. So you're saying, what do I do? Well, first off, let's fix a leaky gut. But what do you do immediately to stop LPS from attaching to toll-like receptor 4? Omega-3 fatty acids and ketone bodies. However, there's one step that's not shown in this particular PowerPoint. When toll-like receptor 4 is stimulated, it transduces a signal to toll-like receptor 2. That toll-like receptor 2 is the pathway that causes atherosclerotic plaque. That's why when LPS is expressed, there's 3 times the incidence of heart disease. So I here, chapter 5 in my book, talks about my Super 7R action plan. The first R is reset. You want to reset your diet, your lifestyle, and mindset. We're going to individualize a diet for you. Health is wealth. Let's get 15 minutes of exercise. Let's get 30 minutes of exercise. Let's stop thinking healthy foods don't taste good, etc. The second R is remove. You want to remove unwanted pathogens. This is where you take your food sensitivities, your food allergies out. You want to remove, here we go, oregano oil, berberine, garlic, serum bovine immunoglobulin, the mouth of the gut, and any kind of biofilm buster. 80% of bacterial infections in the gut, according to the NIH, had a bacteria igloo called a biofilm. The only analogy that I can think of is the biofilm in your gut is like the plaque in your teeth. It's that gummy substance that's protected that sticks. So you want to remove unwanted pathogens. When you're done with that, you want to replace needed digestive enzymes, stomach acids, pancreatic enzymes, and bile. Bile being the missing link. Bile being good for removal of cholesterol. A decrease in bile has a higher incidence of leaky gut and small intestinal bacterial overgrowth. Regenerate. This is where you want to use your cornucopia of nutrients that are pleiotropic that allow to heal a damaged intestinal mucosa and also provide anti-inflammation. I look at the gut in 2 ways. The gut's very interesting in that, one, I want to send the firemen in because they need to put the fire out. But once the firemen are done, putting the fire out, and there's some damage that can be attributed to that, you want to remove that and bring the contractors in. So part one, firemen. Part two, or nutrient two, is the contractors. And part three is the immune doctors. Because remember, once you pass, or whatever has passed the gut, gets to the bloodstream and works within or stimulates the immune system. So you want to regenerate gut lining. Number five, you want to reinoculate. Reinoculate with pre and probiotics. You need those prebiotics to feed the probiotics. Then number six would be reintroduce or retest. If you've done a KBMO food sensitivity test, you may want to retest, but you certainly want to reintroduce foods one at a time over a 72-hour period. If I reintroduce broccoli, if I was sensitive to it and I have no symptomology, I'm good to go with the broccoli. Next food for 3 days. And last but not least, of course, you want to retain your health and your GI integrity. So you would adhere to my Super 5, which would be a multivitamin, multimineral, omega-3 fatty acids, vitamin D3 with K, pre and probiotic, and a solid greens drink. So a lot of people have asked me what I would do if candida was elevated. Well, antifungals like caprylic acid, oregano oil, berberine, garlic, SBI, and of course the protein or the probiotic, lactobacillus strain would be the choice. Tight junction damage, zonulin, occludin, belongum, zinc carnosine, L-glutamine, collagen peptides, curcumin, glucosamine HCl. Because the most effective clinical outcomes across all disease spectrums can result from the normalization of gut functions. Therefore, good gut function, you'll have enhanced longevity. Let's get into the immune system. I'm going to go really quick. I've got my phone here. I want to finish in the next 7-8 minutes and give you guys some time to ask me questions. Immune reboot. So essentially, we talked about the gut to brain axis. I even talked a little bit about the gut to liver axis. There's a gut to immune system axis. There's a brain to immune system axis. There's actually a trifecta of the gut to brain to immune to gut axis. When these are functioning well, they're the trifecta of health. When these are aberrant, they're the Bermuda Triangle. So some genetic backgrounds, things that will damage your immunity will be too much inflammation. It will stimulate aging, ultimately chronic antigenic load, leading to inflammation, leading to immunosenescence and age-related disorders. So again, one of the key components is managing inflammation because it's burning you up inside. Accelerated biological aging in COVID-19 patients. Really wanted to talk about this a little because the long COVID is still present. Every day I treat somebody with long COVID every day. So I know the concern on COVID is waned, which is great. But unfortunately, the residual effect of long COVID and long COVID with Lyme disease. Oof. Telomere shortening. COVID-19 and long COVID has really caused some telomere shortening. There's an interaction between COVID-19 and sarcopenia, the loss of muscle mass. So it's usually attributed to malnutrition or high inflammatory markers like C-reactive protein, interleukin-6, and TNF-alpha. Great conversation about where we Americans are in healthcare, in health compared to everybody else. The US and Japan on the first rounds of vaccines was statistically equal. However, the US had 12 times more COVID cases and 17.4 times more deaths. Well, one of the stats that stuck out to me was the prevalence of obesity. American men were 7.4 times greater obese than their Japanese counterparts, and women were 10 times more obese than the Japanese women. Very simply, we ate more saturated fat in America and considerably less EPA DHA. We also ate more beef, 400% more beef, that grain-fed, soy-fed beef, and our sugar and sweeteners were ingested to the tune of 235% more than our Japanese counterparts. Japan ate more fish, about 44%, a little bit more rice, a lot more green tea. Nothing blocks the dock better of an ACE2 receptor site than ECGC. So one of the bigger problems, without question, is our own health, and it's our diet and lifestyle. Functional medicine, interestingly enough, a body of evidence, there's the citation, was shown that functional medicine can help with COVID prevention, treatment, and recovery. Better functional medicine can help patients enhance immunity to better resist COVID. Life interventions are the critical addition. In a very quick manner, we kind of talked about the innate and the adaptive, the barrier system. The barrier system, there's 3 levels of defense in our immune system. Barrier system prevents entry. It's our skin system and it's our digestive system. So the first line of defense against any defense is a digestive system, which goes from our mouth all the way through our anus. So it has been postulated the first time the outside world meets the inside world is when something gets absorbed through the small intestine. So clearly this is critical. The innate immunity, everybody has an innate immune system. It's a general defense. They're your neutrophils and macrophages, your Marines. They're your 365, 24/7 security guards. They are very stealthy. And without question, they are a critical element. Everybody has them. What's interesting is the acquired immunity, the adaptive immunity. Obviously, it's adaptive. We acquire it through a lifetime. We acquire it with B and T cells. The T cells come from our thymus. Our thymus gland is interesting in that it's the first gland to go through involution. It occurs when we're a teenager. That's why we say those people that are using their ARP cards have a weaker immune system. Our B cells are our antibodies. They're produced at the time of insult. There's different ones. There's IgG, there's IgE, there's IgA, there's IgM. They characterize and catalog what's occurred. Your central nervous system will remember every onslaught, but you and I may not remember that we had this virus 8 years ago, etc. So here's some immune support supplements: vitamin C, zinc, mixed mushrooms, vitamin D3 with K2, probiotics, NAC, liposomal glutathione, selenium, omega-3 fatty acids, elderberry, vitamin A. Here is a long COVID protocol: immune activation, specific mushrooms, maitake, lion's mane, shanga, shiitake, NAD, B vitamins with the dosage, coenzyme Q10, acetyl-L-carnitine, alpha-lipoic acid, glutathione, the master antioxidant, liposomal glutathione is the choice, magnesium, zinc, selenium, vitamin C. 3 ads, new stuff: taurine, creatine, and serum bovine immunoglobulin. Add that to the long COVID protocol. That would be taurine, creatine, and serum bovine immunoglobulin. This whole variant line of Omicron, it's called something different than EG5 now. You got your vitamin D, you got your melatonin, you got your astaxanthin, your curcumin, your quercetin, your zinc, your NAC, your pro-resolving mediators, your probiotics, your resveratrol, and your NAD+. So let's close with some immune hacks, and then let's answer some questions. You want to avoid certain foods. Use my acronyms of GPS: no gluten, no processed food, no ultra-processed food, no added sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Avoid industrialized processed seed oils, vegetable oils. There are no vegetables in vegetable oils. They're very deleterious. And no deep fried foods. Follow an anti-inflammatory diet. Control your glycemic load and index. Detect and avoid food sensitivities. Try and limit your environmental toxic overload at all costs. Make clean eating a priority. Try and eat organic and fork to farm or farm to fork foods. Wild smash fish. Smash salmon, mackerel, anchovies, sardines, herring. Plant-based or plant-forward diet. Fruits and vegetables, grass-fed meats, high-fiber foods, nuts and seeds, chicken soup and bone broth. Any herbs you would use would be ginger, turmeric. I'm going to have a snack before my patients come in when we're done with this webinar. Little organic dark chocolate. Make sure you have appropriate food intake. Organic coffee and tea. Coffee is the 3rd most sprayed item behind cotton and tobacco. Please, organic coffee and tea. Watch those oils: extra virgin olive oil, coconut oil, avocado, and macadamia nut oil. And lastly, some lifestyle hacks: intermittent fasting when appropriate, sufficient sleep, home exercise program, get moving, weight resistance, flexibility, and cardio, chiropractic care, low level laser, modify your stress, and support your immune system. It has been stated, JFK said, it is better to fix the roof on a sunny day than wait to a rainy day. And I extrapolated it into, instead of only reacting to disease, I think we should be more proactive and lead a healthy lifestyle, which help reduce the risk and prevent disease. Here are a couple of things for immunity, a couple of protocols and products that everybody could use. They were picked from the litany that you have options at FullScript. If anybody wants to follow me on social media, there's my Facebook. Please take a picture. There's my Instagram. We're posting every day, all day. I've got a fostering a growing podcast called Proven Health Alternatives. If you want to go to my social media, it's drrobertsilverman.com. I will be at 8-4M. I'll be doing a book signing for FullScript in KBMO Diagnostics. Anybody interested in the book? Here we go. And I always like to end with a quote. Jim Rohn once said, take care of your body. It's the only place you have to live. And it's question and answer time. We've got a few minutes. Let's do it.
Thank you so much, Dr. Silverman. I will get us started with the first question. What supplements remove senescent cells?
For me, there's an argument what is senolytic, but for me, alpha lipoic acid and berberine are great choices for senescent cells. Pro-resolving mediators, anything that decreases inflammation will be very senolytic.
Great, thank you. The next question is, generations of certain vegan populations in India were able to get adequate omega-3 FA from plant sources for generations. Did they convert the flax to DHA and EPA?
I don't have a direct study, and I know the study that you're talking about. I think that you can get omega-3s, and there are people who do convert. I just think the data really indicates it. So the question is, really, do you need to supplement with omega-3s, and do you need to supplement with pro-resolving mediators? In theory, I think we all could get enough from food. The reality in America where we live, it's very hard to get enough omega-3 fatty acids. And it's definitely really hard in that to get them to convert. So I'm a big believer in supplementing when needed. And unfortunately, most people need it. Didn't say all. And here's a little caveat for you. And I hope I didn't go off the plane not answering the question. Virtually every cell in our body has an omega-3 and a vitamin D receptor. So somebody and something's telling us to make sure that we get the right amount.
Great, thank you. The next question is, how do we eliminate zonulin?
That's a great question. So zonulin, I can flip back. Well, first of all, one, obviously avoid dysbiosis. Number two, don't eat wheat. Don't eat gluten, especially American gluten. And I'm going back. And three, if you have any problems with zonulin, there's a protocol. So zinc carnosine, L-glutamine, a good quality probiotic, collagen peptides, curcumin, and glucosamine. So the prevention is what's in the diet. The cure, if you're damaged or elevated, is right there in front of you.
Great. The next question is, what is the difference between functional medicine and naturopathic medicine, and which one is older?
Well, I'm not a naturopath, as everybody knows. I'm a chiropractor. So I would say naturopathic is before functional medicine, in that I think Dr. Bland coined it about 30 years ago, and it's now gone into different renditions. I use the term functional nutrition, naturopathic. But the bottom line is all our aligned health services, whether it's MD, through chiro, naturopathic, health coaching, our goal should always be to get to the root cause resolution. What is causing the problem? And that's what we should base all our encounters on. Look, as a chiropractor, there are people that come in and they, on a visual analog scale, they say the pain is a 9 or a 10. And they really don't want to hear that, you shouldn't have tied your shoes the wrong way because that caused this massive back pain and sciatica. They want you to deal with the pain. But ultimately, again, you want to individualize, personalize, and get to root cause resolution if that's at all possible.
Perfect. I think we have time for one more question. So the last one is, do you think mindset is a strong longevity factor?
Without question. I mean, it's an interesting thing. Again, I always like to refer to patients, and I saw some patients today, and young girl, and she kept telling me, I took a beta blocker, I took this, I took that. So she was trying to say, as we gauged her and measured her improvement, it really wasn't improvement. It was because she took the drug. And I said to her, you realize that you're not accepting what's going on. You haven't flipped your mindset. So after a few more minutes of treatment and modulation, I had her walking around, and she asked me, and she turned around, and she said, do you think I can go back to exercise? The change in mindset. Look what she said. She's indicating to me now she feels better. She wants to do something. So I think mindset is critical. I mean, nobody has a perfect life. There's no perfect outcome. But I tell everybody, I can tell you this, people get healthy faster when they're positive than versus they're negative. It's a good vibe.
Definitely. And I think that is a good place to end it. We are at time. Thank you so much again for being with us today and for the wonderful presentation. We will be sending out a recording of today's presentation with Dr. Silverman, so keep an eye on your inboxes and have a wonderful rest of your day.
Thanks, everybody.